Hey guys, it is Saturday, July 8th, and I said I would do a video, excuse me, on bathroom and urinals. So I'll go right into that, and I also want to add in some things that change with testosterone that I have been forgetting to talk about. So anyway, when I first started transitioning, prior to that, I never really was a big public restroom user, and I just didn't care for the dirtiness, and also I resented the fact that I had to go into the female bathroom. I didn't feel a part of it. I felt like everybody watched me, looked at me, felt uncomfortable around me as much as I felt uncomfortable. So when I started transitioning, I figured, I didn't really worry about it much because I hardly ever use the public restrooms. And so when I had my top surgery, which was about 6 months later from my first shot, we had to commute 5 hours. And I had drains in me, and I had to use the restroom, so we pulled over to a rest stop. And I thought, oh God, the worst thing I could do is pull over to a rest stop, have to sit to pee, and in a public restroom, in the men's restroom. I don't recall exactly how that went, except for I remember being very nervous about walking in there, and I just finally had to, because I had to use the restroom, and we still had 2 or 3 hours to go. And so what I did is I just focused straight forward and went right to the stalls and looked at the cleanest one and did the best I could, putting the toilet paper down. But I don't really remember the feelings I had at that time. I know I was nervous, but I do remember kind of pacing before I went in just to see, because the rest stop for my benefit was not real busy. That was my first experience. After that, excuse me, again, I didn't worry about the public restrooms, and I'm not really in a position where I find myself having to go to a public restroom anyway that much. But I do remember what I did is I started going into them just to wash my hands, just to feel the etiquette in there, just to get me more comfortable walking in and not looking straight at someone. If I do make eye contact with someone, I just nod my head, smile. It is true, they really don't care. I think the media on the events that has happened is mainly just the overly right outcry conservatives. And unless you bring attention to yourself or make it known with a bunch of type A guys around. I mean, common sense tells you if there's a bunch of type A guys and there's drinking involved, you're not going to put yourself in that position. So now, the question I got was how do I handle it since the phalloplasty? So prior, very nervous, fact that I had to sit to pee, even though I knew guys in my own family sit to pee, still, because we know we have to, it's not a choice. I think we bring more anxiety on ourselves than it's necessary, and I couldn't tell you how to deflate that and relax, because no matter what anybody tells you, you have to handle yourself. So I would hope that something that I say will trigger something to help you. Again, number one, I suggest, if you haven't tried it, just go in and wash your hands. That's all you do. Focus down. The more nerves that you show may draw more attention that you would have had than in the first place. So second of all, if you don't have to use public restrooms, don't use them. But when I had phalloplasty, I probably had used the restroom maybe 5-6 times. I would say 10 times at the most, and I'm more than positive I didn't hit that upper 10. So it was still nerve-wracking in the beginning. Even though I knew I could go in there and just stand. I'm really sorry. It's because we were not socialized that way. We were not brought up that way. And so there's a lot of reels of film in our brain that needs to be rewound and put away, and put a new one on and start rolling. And you learn as you go. Unfortunately, a lot of us are adults now, and so it's hard on us to learn childhood behavior and etiquette for our gender than it is for biological. So let all the old reels rewind, put it aside, put them away, and put a fresh reel on and take baby steps. Okay, let's get back to me again. So the phallo, it's been 2 years, and I was nervous at first, but just the fact that I can go into a stall and stand in front of the toilet made it much more easier. I don't look at anybody, and like I said, if it happens that we make contact, if it's long enough to where I need to shake my head and smile, or like hello and that nod my head in that way, I do. And I really don't care what the etiquette is as far as that's concerned. I am going to be a pleasant human being, a kind person. So I don't need to carry an attitude like, or just look at someone and not even make a gesture when you're making eye contact. I'm not that kind of person. Maybe some people are, and they feel that's the way they should be. That's okay, but I'm not going to bring anything that could react in negative towards me in general. I just ate, and I ate some gluten-free pancakes, and I think it's the sugar that's causing me to all of a sudden want to go on a low. The maple syrup, 100% raw maple syrup, but it's still sugar. So anyway, that made the ease of having to use a restroom 100% better. And I still, to this day, don't use public restrooms unless I have to, because they're just dirty. So let's talk about men's restrooms real quick and the filth. And women's restrooms are getting just as bad nowadays. The etiquette of people and the ethnics of people has really changed, and it's really depressing. But there has been times when in my peeing experience post phallo, that when you start going, it just squirts all over the place. You have no control of that. And I'm like, what? So I'm like, what the hell? I'm having to take a tissue and wipe up everything, and having to get a rag and clean up around the toilet and stuff. And it was getting really bad just before I had my implant done. And I asked Dr. Chen about it. He goes, Ethan, I've been peeing this way for 32 years, and I still squirt all over the place. He goes, I think it's just the way sometimes the urethra is. He goes, I can't tell you why we do that. So that kind of made me feel better, but it doesn't make me feel better in the way of hygiene. But so when you go into a public restroom and there's pee all over the toilets, none of these guys are going to sit and wet a paper towel and go and clean around it. They're not going to care. But that's why a lot of them, you think that they're pigs, and don't aim for the toilet. A lot of times it's not their fault. And even older people, older than me, they have a hard time seeing the toilet, for God's sake, Talked to my stepdad about that. He's going, last year I've had a hard time aiming. But so yeah, I wanted to throw that in there real quick. You'll learn a lot about men as you transition that the women have found fault in, and thought, how gross, how can you be that way? A lot of times it's innocence, but now at home, guys, you should be cleaning around that toilet. You should be washing the walls if you hit the walls. There's no excuse for that. But in the public restroom, what you do is what you do. But now let's talk about urinals. So I was asked how I felt about urinals, or have I used urinals. When I go into a restroom and they only have one toilet and 3 urinals, I feel kind of bad if I take the stall, because it's more like a handicap wheelchair stall. And I have done it. I was at Kaiser and I had to go, and it was that situation, but a guy was in the stall. So I went to the furthest urinal that blocked me from the doorway and anybody coming in, and I just kind of stood the way I felt I wanted to stand, and I stood kind of catty corner, hiding myself. And I thought, this is my pathway. I don't have to stand right straight in front of it. If I don't want anybody to see me, I don't want anybody to see me. And so that's what I did. And I was nervous about the me not getting all the urine out. Now, the thing with fallow is we have a lot of tubing down there, Dr. Chen told me. And one of my buddies had told me if you grab behind the scrotum and push up, a lot of that the excess will come out. And I had found that if I grab the base of it and squeeze, that it'll still keep squirting. You have to milk it that way. So either way works. When I go behind the scrotum, a lot of it comes out still. And when I push the base, kind of milk it this way, a lot will still squirt. I will make sure nothing squirts, and then I'll go down the phallus and get the excess out in the tubing. And that pretty much works for me. Now, 2 times I have put myself back in and zipped up my drawers and had a little leak spot. I freak out over it. But I will tell you, it's not uncommon. When I was at a rest stop one time waiting for Tony, a guy came out of the bathroom and he had a big old wet spot. So that just says he hurried up, and and there's no reason, I don't know why he did. But for me, you get nervous and you try to milk it, but you're not going to stand there all day trying to milk it in front of these guys. So that's probably what happened with me. So I don't have a problem using the urinal. Now, there was a guy, when I came out of the stall, a guy was at a urinal. There was two other urinals open, but this guy was standing over by the sink in his phone, and I thought maybe he was waiting for the stall. But I didn't give him time. I didn't wait around to see where he went, if he even went anywhere. I went right by him, washed my hands, and left. I just have the attitude that I'm in there to do one thing and one thing only. I'm not in there to strike up a friendship or a conversation. So that's how I handled it. So real quick, here's some changes that for you guys who have just started out on tea may experience. And remember, all this is my ideas, my theories, and what I've experienced. So take a little bit of what you watch and see if anything fits you. And if anything I says doesn't fit you, it's okay. You're still getting another aim or another way of looking at things. But again, real quick, so I have not trimmed my nose hairs, okay? So I'm not being gross, but you get really long nose hairs, and let me tell you, like when you sneeze or you blow your nose and you still have liquid in there, when it starts getting hard, it itches like hell, and you have to pretty much get your finger in there and just do that real quick, because doing this doesn't always get it. It makes it itch more. And I'm not saying I'm not justifying any nose picker in public, but I am justifying someone, if you see someone who does that real quick, it's because they can't get the itch out and these damn hairs. I also have the wax in my ears, powders now, to where I have flakes, and I always have to do this, and I have flakes, or Tony will look in my ear, and I've just taken a shower and cleaned my ear with Q-tips, and I'll have these flakes, like dry skin in there, but it's the wax. And so that's changed in me. And these white things I told you about, okay, that I've never had. Just, I went to the skin doctor last week because I had something come up on my arm, and he said, all your skin issues, I've been looking at your history, are, I forgot the name of it, but it says something about granules or something, skin. And he said, you don't have any cancerous stuff. And I asked him, well, what is these things on my face? He goes, those are oil ducts or oil pores. That's just trapped oil. I'm like, really? It's not, it doesn't even feel like a pimple. And so yeah, I'm coming up with those too. And I've looked around at my family, none of them have that. So it's not genetic, it's just me. But that's what's going on with me, guys. Hope you enjoyed the video. If you have any questions, just ask me it and I'll answer it on comment, or you can PM me. I'll do my best to get back to you. But yeah, so things are kind of starting to settle down now that Tony's done with both surgeries and she's getting better. I'm going back to my therapy group, and that's really helped me with debunking from all these medical frustrations and anxieties. So anyway, you guys, take it one day at a time and always make your journey as simple as possible. We'll talk to you later. Bye.